Welcome to Menopause Made Easy, Part 2. This video will cover the basic clinical checkup and clinical investigations. The patient will come in complaining of some sort of symptoms, be it vasomotor like hot flushes or vaginal dryness, or some urinary tract problems like urinary frequency or insomnia, irritability, or skin changes. A case history should be taken from the patient for past gynecological problems, any family history, any induced menopause, whether her ovaries are intact, whether she's had the ovaries and the uterus removed in the past. Clinical examination in the clinic, a bimanual vaginal examination. The uterus may be smaller, or there may be uterine prolapse, or the muscles of the pelvic floor may be looser in tone or are thin. The breast may have lost its turgor, the labia may be smaller, and the skin may be dry and thin. You may, on a case-to-case basis, do a vaginal smear, endometrial biopsy, pap smear for cervical cytology, a hormonal analysis, estrogen 2 and FSH levels, especially if you are considering hormone replacement therapy. A lipid profile to assess cardiovascular risks, and a mammogram should be undertaken according to age and national guidelines, and especially if you are considering hormone replacement therapy. You may do an X-ray, you may do a pelvic ultrasound for ovarian size or endometrial thickness, bone density. For bone density studies, you may do a dual energy X-ray or DEXA scan, or a single or dual photon absorptiometry. Bone mineral content can be considered, calcium and phosphorus. And on a case-to-case basis, bone mineral density, total body mineral density, total body bone mass, and markers from blood and urine like osteocalcin, calcium and phosphorus again, alkaline phosphatase enzyme, and hydroxyproline, which are the amino acid from connective tissue in the bone. Or in severe cases, maybe you may consider a bone biopsy. So that's all for now. In the next video, I'll talk about the management of menopause. Thank you for listening.